San Diego 6 News in the morning. Your station for balanced news.
Natasha Richardson's death brought up so many questions about what to do if you sustain a brain injury. Remember, at first she thought she was fine, and in just a few days she was gone. Coming up, we'll speak to a leading local emergency room doctor about brain injuries and what you can do to avoid them.
Actress Natasha Richardson's death reminds us all of the dangers of head injuries. Up next, our guest from Alvarado Hospital will tell us the warning signs to look for. Well, actress Natasha Richardson's passing after a head injury while skiing has everyone wanting to know what the signs and symptoms are when it comes to a severe head injury. This morning, Dr. Rob Bay joins me from Alvarado Hospital. You work in the ER, and unfortunately, sometimes you see some of these massive head traumas that come in. Let's get right to the basics, doctor. What are the symptoms and signs we should be looking for at home if, if it is a severe head trauma case?
Sure, absolutely. There's so many things that you can see with a head trauma, but in general, I would look for things like nausea, vomiting, more than 2 episodes. A prolonged loss of consciousness is also something that you really want to look forward to, or not look forward to, but look out for.
Right, right. And then you also have some loss of short-term memory, repeating thoughts and ideas. Those are all things that we should take note and say, okay, I think that this is just not a headache. This is not just a little bump on my head. I should probably go see a doctor, right?
Absolutely.
Okay.
I mean, I can't tell you how many times I've seen someone come into the emergency room and actually forget the event. And someone like that really needs to come sooner rather than later.
Now, I know you said you can't comment necessarily on Natasha Richardson's case, but what are some of the common head traumas that maybe you see working in an emergency room?
Absolutely. I mean, there's a lot of people out there doing things like extreme sports, including skiing, skateboarding, surfing, and I see a lot of head injuries from that, but also just in your regular house, falls, going downstairs. There's a lot of cluttered objects in people's houses. They'll fall right over them, and you can sustain a very serious injury from that.
So when it comes to these really bad injuries, what are some of the things people should expect when they are taken into an ER? I'm sure every case is different, but if you have a head trauma, what are some of the things that maybe you should remember or try and have noted so that way the doctor can maybe diagnose your case better? What are some of the questions you ask patients?
Well, absolutely. This really helps us a lot if you give us the exact mechanism and how things happen and as much information about the case as possible. You need to also tell us about your past medical history. If you had a recent head trauma, that's very significant. If you have bleeding, things like hemophilia, that's certainly something we want to look out for. And also, if you take medicines like Plavix or Coumadin that thin your blood and make you more prone to bleeding. We'll also do, and those things like medications and allergies should probably be kept in your wallet because you don't want to.
You want to be able to give it to you right away. What about kids? I mean, we all know kids fall at the playground. What are some things parents should maybe look for if a kid falls off a swing set or falls off a slide? Because sometimes, I mean, they can yell and scream and it might not be anything, but sometimes it is something. What should parents be looking for? Well,
children are definitely more tricky because they're not as good as telling you the whole history and what happened and how they feel and their headache and whatnot. So I would say any loss of consciousness, no matter how long, is certainly something to come immediately to the emergency room for. But also, if the child's acting stranger than normal in any way, maybe perseverating on a certain thought or idea, repeating their phrases, or some kind of memory loss as well.
Let's talk helmets, because I know that's obviously something that can help children. Helmets, do they prevent these traumas most of the time? Or?
Absolutely.
Okay. And so that's something we should definitely be doing.
All kinds of safety gear is available, and you really have to know your boundaries when you're doing things like skiing or mountain biking, especially because you can really sustain a great degree of injury.
Yes, as we've seen, obviously.
Even with small traumas. So. Yeah, I think you have to be real careful and use all the safety precautions, and general common sense is probably the best idea.
All right. Well, Dr. Robert Bay, thank you so much for being here this morning. Lots of good tips and some good advice for our viewers. Of course, for more information, just go to our website, sandiego6.com, and click on Hot Topics.